What is happening now with Healthy China 2030 is that Xi Jinping, he has made it very clear that it's not only about the economy. It's the economy, it's the ecology, and it's health, okay? And he also emphasized the importance of health in all policies. This is a breakthrough. And what happens in China matters for the world. So what is emphasized in this is the role of prevention. Because you see many problems in countries like China and others also. Yeah. I can mention Japan, I can mention India. It's the epidemic of non-communicable diseases, okay? It's an aging population, and these two things put a lot of challenges to the health system. And prevention is key here for sure. If you look at some of the aspects of the strategy, you can see that there are measurement indicators which are conventional: infant mortality rate, life expectancy, maternal mortality rate. That's not. More important is the healthy life indicators, where health literacy is underlined, and health literacy is a huge problem in China. I found it in many areas, for example, in relation to the work we're doing with antibiotic resistance. And if people don't know the causes, the roots of the problem, forget behavioral change. If you want to handle the Chinese health system in a positive way, that's a large system transformation. Large system transformation. This takes leadership. It takes evidence, like what George Institute is trying to provide. It takes feedback loops. It takes the triangle that moves the mountain. You have the knowledge generation, you have the policy makers, you have the decision makers, and you have the public. And there needs to be an interaction with all three of them if you have big challenges. A remarkable improvement when it comes to health insurance coverage. Maybe 95, 97%, okay? Which makes out-of-pocket spending and, poverty because of illness less frequent. But it exists. So it doesn't cover the cost fully. And why is that? It's because the medical technologies costs increase all the time. So this is one challenge. Another challenge is that people don't go to primary health care, they bypass primary health care and go to expensive tertiary hospitals. It's not only a question of competence, but also competence. There are no continuing professional development programs, as far as I know, in primary health care. So there is little recognition. The doctors are not being paid in the same way as doctors as hospitals. Working conditions, arrangements for schools, etc. So there needs to be a major reform when it comes to primary health care in order to make it attractive, trustworthy, good quality, and so on and so forth. And there are different ways here. You can invest financially, but also information technology. So you need improved quality, you need affordable care, and you need an understanding that the cure delivery system needs to include prevention. And even more, it needs to be turned from a cure delivery system to a social security system. So these are a few humble observations and suggestions.